When you buy an existing practice, it's really hard to flip culture and branding on its head on day one. Now, I would expect that the doctor who's buying is really working to evaluate, is this a culture that I want to buy? Philosophy of practice the same. So do we see our patients and treat our patients in the same way? And if that doesn't align, that culture shock can really destroy a business. In fact, I have a client who's really struggling with that right now, bought a business, and the buyer and seller are not getting along. And so that smooth transition that might normally happen when you buy an existing practice because the seller wants to see their patients taken care of and their team taken care of is kind of falling apart. And it's truly just, they're very different personalities. And that wasn't part of the due diligence process.
So this is the only time I have seen practice transition not be successful. It doesn't have to do with almost anything financial. It has everything to do with the philosophy of the practice of medicine. So as much as we as financial professionals really focus on, make sure the tax returns tie out, make sure we're looking at, vendor payments and, like kind of the typical due diligence checklist. And we as financial professionals are great at helping clients through that. And that's all very important. But the most important thing is you, the doctor, stepping in if you're buying something and saying, yes, I can fit with this team. I can fit in this neighborhood. I can fit with this patient base. This doctor does the same diagnostic things that I do. And so my revenue is not going to crash when I come in and do a different set of procedures. And that failure to evaluate that on a purchase is the only time that I have seen a practice acquisition go sideways.